Awesome. Good evening, everyone. Welcome to another med school presentation. This session is being recorded, and today we have Caleb Marsh and Jerome Hill from Thomas Frist College of Medicine. It is a new medical school, so we're excited that they have gave us generosity of time to present and some insights. So if you are comfortable in doing so, I'm sure they would like to look at faces and not boxes. And definitely go ahead and I will just hand it over to Caleb and he'll introduce his team and such.
Awesome. All right. Can y'all see this here? Let me make sure. Got a lot of menus open on my screen right now. So give me just a second. I'll get us all set up. All right. So as Zuri was mentioning, my name is Caleb Marsh. I'm the Director of Pathway Programs and Recruitment here at the Thomas F. Frist Junior College of Medicine. And we're going to tell you a little bit about our new medical school. I'll just give you a little bit of background about me. And then Jerome, I'll turn things over. He can give you a quick intro about him as well. I was previously a health professions advisor. So I started my career at Baylor University, advised students in the health professions there, went to University of Texas at Austin, also advised health profession students before becoming the director of health professions advising at Southern Methodist University in Dallas before moving across the country to work at Temple University in Philadelphia at the postbac program, where I worked in both admissions and advising. And then I had an opportunity to come open this brand new medical school here in Nashville, the Thomas F. Frist College of Medicine. So that's kind of my pathway to get here. I worked a lot with health profession students. I'm really looking forward to telling you all about the school today. We are going to have a Q&A period, but we're going to hold all questions until the end. This allows us to kind of get through our presentation, tell you all the information that we have, and then at that point, we'll do plenty of Q&A specifically for y'all. So Jerome, you want to go ahead and introduce yourself?
Sorry, unmute myself. So my name is Jerome Hill, and I am from Nashville, Tennessee, born and raised. Basically, graduated from MTSU with a degree in economics, and basically worked in marketing for about 5 years. And I realized I developed a passion of helping students get to that next level, which led me to education, and ultimately, eventually led me to this role as a student recruitment coordinator. And also, one thing about me is if you're on the phone, if you call the phone at First College of Medicine or your prospective student, and you'll probably hear from me. I will more than likely be the person that you talk to. Or if you call the voicemail, I will be the voicemail that you hear. And so definitely excited to work with you guys, excited to hear more about the questions you have, and we're excited to answer them as well. I'm going to pass it along to Kate.
All right, so we're just going to get started here. First of all, I just want to talk a little bit about our mission, vision, and values. These are actually in flux. I think this is one of the things that you'll learn about a new med school or any new organization is that at the core, our mission isn't changing. However, our vision and values are, like I said, always being developed, honed, and we want to make sure that they're reflecting the work that's going on at our medical school. So one of the things that I really want to point out here, kind of these three tenets of diverse physician leaders, and we'll talk a little bit more about each of these kind of points in detail. We'll talk about our whole person approach, and there's two ways that we talk about whole person approach: how we trained you as physicians to speak to your patients, but also how we as administrators treat you as students at our medical school with a whole person approach. And we'll talk about how we facilitate that later. And then this idea of service learning. A lot of people know what community service is, but with the idea of service learning, it's integrating these service components into the way we learn and what we teach you. Again, teaching you how to be the best physician possible. And so this idea of service learning is also just a reminder, medicine, it is a service profession, whether you think it is or not. No matter where you go to med school and however you're trained, you are going to be seeing patients at their lowest point. You're going to be seeing patients when they're most vulnerable and when they need you the most, and when you really need to show that care and compassion. And so our vision statement is shaping medicine through transformative whole person care. I'll also point out one part of our mission statement, the love and grace of Christ. This is directly from our parent institution, Belmont University. Belmont University is the largest ecumenical Christian university in the country. But I just want to make it very clear throughout the presentation that you don't have to be a Christian to apply to Frist College of Medicine, nor do you have to be a Christian to get in. At no point on your application are you asked, are you a Christian? Nowhere on your supplemental. So I know I've heard some rumors about that floating around that's not true, but just wanted to make sure that you're clear about that. We want you to come here and embrace who you are. We want you to worship in the way that you want, whether you're a Christian or not, or if you don't have an organized religion you're a part of, that is okay too. So you'll see throughout, we talk a lot about these values. One of them is the dignity and worth of all people. You'll see diversity and inclusion, humility, integrity. You see that servanthood aspect again. We're looking for critical thinkers, lifelong learners, and we're actually in the process of honing these values as well. So another thing that you have to be ready and willing to embrace as a student at a brand new medical school is that things will change. Things will be growing. The culture at the med school will be developing, and we want y'all to be a part of that. So these are just some of the values that we hold dear. So one of the questions that students typically ask right away is just about accreditation, what that looks like. And so I'm going to kind of give you guys a crash course on med school accreditation. That I've been learning a lot as I've worked at my first medical school. But I do want y'all to know that on October 11th of 2023, we were granted preliminary accreditation. This is the first step in the med school accreditation process. Any new medical school has to go through this step. And this really, once this is granted to us, this means that we can start recruiting and accepting students. So once we were given that green light on October 11th, we turned around in November, we opened up live on AMCAS, and we are in the process right now of actively accepting applications through AMCAS to the Thomas F. Frist Jr. College of Medicine. So let's just say you apply this year, you get admitted, you will show up July 29th at our orientation for our inaugural class. Then in the second year, that M2 year, you'll be moving toward what's called provisional accreditation. You'll be an active member in this through student surveys. We're going to want to get feedback from you to make sure that what we think we're accomplishing is being accomplished. And we rely on a lot of feedback from students to make sure that happens. So after that second year, we'll be granted provisional accreditation. And then finally, we'll be given full accreditation as a medical school when we graduate our first class. And again, this is any new medical school goes through this exact same process. TCU in Fort Worth is one of the newer medical schools to just finish and graduating a class to become a fully accredited medical school. University of Texas Tyler is another one that's about a year behind us in the process. And then I guess this is also a good time to remind y'all that accreditation is an ongoing process. This never stops. And even current medical schools are always being evaluated for accreditation. And so this is something that we feel very confident about. We have a lot of people in place to make sure this happens. And so this is what the accreditation timeline looks like. We also understand that being part of a new medical school, that this could be a little scary to be part of, but this is why we're looking for people that are okay with maybe not having every pavestone in the pathway perfectly aligned yet, and that you're going to be a part of helping us kind of lay that out. So this is a question that we get also a lot, and we get this really in two parts. Locally, we get the question of, why do we need another med school here in Nashville, Tennessee? Currently, we have Meharry and Vanderbilt, two very old, well-established medical schools that have been around for a very long time. But we feel like Vanderbilt and Meharry have a very specific niche in what they're trying to accomplish as institutions. And we feel like we still have something different to accomplish at the Frist College of Medicine. But overarchingly, the why is there's a physician shortage across the country. We need more doctors. We don't just need more doctors here in Middle Tennessee. We need doctors everywhere. And so this charge here from the Association of American Medical Colleges was kind of laid out on what we need to do to try to improve and get more physicians across the country and address that shortage. We also want to diversify the physician workforce. And then also COVID really exposed kind of this idea of preparing folks for public health crises and having physician leaders ready to help guide a country or guide a community through policies and procedures in a time of COVID. So this is really why we are needed as a med school and why more medical schools are needed in general. Jerome, you want to take this slide? I know there are a few native Nashvillians anymore, but do you want to talk a little bit about living in Nashville?
Yes, I would love to. So I am from Nashville, as I stated earlier. As you guys can see, if you look at this photo right here, this is our campus. I don't know if they can y'all see my mouse?
I'll help
Okay.
you out, Jerome.
Yeah, there's, as you can see, the campus is right here. And then in the back, you can see the skyline of downtown Nashville. And so with that, we are 2 miles away from downtown Nashville, which is not far at all, as you guys can see. And we have about we're pushing 700,000 people and growing. Also, we have a vibrant restaurant and coffee scene that's all over Nashville. But I want to highlight that our campus is near a few neighborhoods that are around that have great coffee shops, and they have great restaurants that are very close and within walking distance. Actually, we were just talking today about our medical school being right next to a amazing coffee shop that also has great food as well. So you'll be able to walk outside, get your coffee before class, and then come straight to class. Also, we also have beautiful parks and beautiful and outdoor spaces. So if you also look at our campus as well, you see this large, huge green field where students congregate, play games, talk, socialize, and do so many other things as well. But yeah, we have amazing parks, a little bit of hiking, and also we are the health services capital of the world, home to HCA and also TriStar, which is one of our companies that we do rotations with as well. We'll talk a little bit more about that later, but we are considered the health services capital of the United States of America. And when you get here or you do research on it, you'll see what we mean by that and some of the amazing hospital corporations that are in Nashville, Tennessee, and also insurance companies as well.
Yeah, so Jerome is exactly right. There's tons to do here in Nashville. As the Nashville transplant plan, I've really taken to it. It's a cool place to be. I think most of y'all kind of think about like bachelorette parties, bachelor parties, honky tonks, bars, music scene, and yes, definitely is part of it. But there's a lot more to Nashville, I think, than people realize, and we're excited to get people here to kind of show y'all what that's all about. We're also excited to get you here because we can't wait to show off our beautiful brand new state-of-the-art building. It is wonderful. I don't know how many of y'all follow us at all on Instagram. If not, you should. At Frist Med, we've been posting a lot of photos about our new building and how it looks. In fact, I just took a new tour on it on Friday. We don't get to move into the building until April, so we're just really excited to get in there, and then we're excited to welcome y'all to the new building. It's giant. The coolest thing I think about this is that it is really designed for y'all. It is designed for students, designed for learners. It's made in a way, it's not some retrofitted building that we had on campus that we've changed to become a med school or made it work. It is designed after having looked at a lot of other med schools across the country to try to put it together in the best way for you as a learner. There's all kinds of study space, all kinds of library space, some to be done in groups, others that can be done if you're more of an individual learner. And then there's also, I know in cities with universities, parking is always an issue. There's a 650 space below ground parking lot under our medical school. So there will be plenty of well-lit, safe, dry, warm parking. And so I think that that's a huge upside. Not to mention, it's just gorgeous. Like I mentioned before, this is a rendering of the building. This is another rendering of what the lobby looks like. It's funny, Jerome, we used to have to rely on these photos. Now we've actually been in this building. This is the lobby, a rendering of the lobby. And this is one of the sim spaces. I was actually just in this space on Friday. We don't have the beds and the mannequins in there yet, but it is all set up and ready for all of the equipment to come in. And as I mentioned before, it's state of the art. So one of the things you can kind of see here, the building is much further along than this, but I wanted to show you this video so that you can kind of see where we are in relation to downtown Nashville. As Jerome mentioned, we're very close. But as the camera begins to kind of pan around, and what you'll see back to our right is where Belmont University campus is. And so you can see here are some of the residence halls over here, and then over here is the edge of campus. And so I say this for two reasons. One is to let you know that you are in very close proximity to the Belmont undergraduate campus, which means you have access to all the dining, gym facilities, basketball games, library, anything in addition to the med school. You'll have all of the support of the undergraduate institution too. But I also show you this to let you know that another common question we get asked is, can I come tour the building? And right now the answer is no, we can't even get in there yet. But once we're open, we're going to have the opportunity for students to come. If you're happen to be in Nashville for the weekend, you want to come in, tour the building on a Friday or Monday, we're going to have some days designated for those open houses for you to come in and actually see the med school. If you're in this class and you're applying, we are doing all of our interviews virtually. However, if you're admitted, we're going to have a second look day for students to come to campus. We're going to try to make that second look day coincide with the grand opening of our building so that all of the new inaugural students can be part of that grand opening, can meet us all in person, see the building in person, and really get a feeling and a vibe for what we're like here at the Frist College of Medicine. And also, of course, to show off our beautiful building as well. So going to be a really cool experience. We're really excited for that. However, on the next page, this is the most recent photo we have of the building. This is not a rendering. This is it. It's brand new. And our offices are right down here, student affairs, and the 5th and 6th floor up here is where you'll be spending most of your time as the med school students. We'll talk about some of the ways that we're going to use this facility, but it's a very impressive building. So we talked about where you're going to learn. Talk to you a little bit about how you're going to learn and what you're going to learn. I think in many ways we teach med school. A lot of med schools teach it very similarly. I mean, the goal is to teach you the science behind the medicine, and the goal is then to get you trained to be a doctor. And we really, over the 4 years that you would be here for your med school training, roughly the first 2 years, it's a little bit shorter than that. It's more like about 18 months, I think, is what it is for the first foundation phase. This is where you learn your organ systems based courses. This is also where it's really cool. You get to do something called ICP, or integrated clinical practice. And the best part about this is I mentioned Belmont, I mentioned the close proximity to Belmont, and I mentioned that you'll be working in close proximity to other Belmont students. But when it comes to other programs at Belmont, you may or may not be aware, we have a nursing program, a pharmacy program, physical therapy, occupational therapy. We have a lot of other health professions, and you'll actually be taking some of your clinical practice courses with those folks. And so you'll actually be able to learn in an environment that it reflects how you will actually practice medicine when you get out into the field, because you will be working with PAs and nurses and physical therapists. You're also going to have your professors teach your sciences, but then you're also going to have physicians that will come in and teach and talk about how, okay, great, you just learned that science, but now we're going to show you how that science actually shows itself in patients, how it presents itself, what symptoms look like, and how you can use that in your diagnosis of patients. So it's going to be a really cool way of teaching the courses. We're also going to have what we call SSFH, which are social and spiritual foundations of health. These are threads that are thread throughout the curriculum. You'll learn about things like medical ethics, spirituality, health equity, anti-racism, and you'll just a number of topics that impact the social determinants of health. And we really wanted to make sure that this is built in throughout the curriculum as well. After essentially your first 2 years, then you'll move to clerkship phase. This is, I think, the stuff that you guys all get really excited about. This is when you start to practice what it's like to actually be a doctor. You'll be exposed to a bunch of different specialties. You'll do this for 12 months before moving on to the last year and your 13 1-month course blocks of individualization phase. And this is where you'll start to really hone in on the things that you like. You'll do electives. You'll really take the time to learn more about what you think you want to do, because then after that, you'll apply to residency. And we actually have a capstone residency course to help you get ready for that. We'll also talk about how the Office of Student Affairs and Diversity is going to help you with that process as well. So this is kind of a quick look at the curriculum. If you get an opportunity to interview at the med school, we do a little bit deeper dive into the curriculum, and we'll look at that a little bit more, but we'll stick around at the end. And of course, if you have additional questions about that, we'd be happy to answer them. As Jerome alluded to, we have clinical affiliates. The clinical affiliates, a common question students ask is, how close are these to our med school? And they're very close. It's very easy to get to the TriStar Health System, Heritage, Medical Associates, and Siloam Health. They're all right here in Nashville. However, as Jerome mentioned, TriStar, which is part of HCA, is a giant healthcare organization. And there will be opportunities to potentially do some clinicals away. And then, of course, there are a lot of rotations that can be done away at other hospital systems too, if that's something that you want to explore more of. This list is definitely growing. We're adding to this. I probably should add the Brentwood Pediatrics logo to this slide. We always talk about it being added, but that's another one. And again, they're all very local. So another common question is, do I need to get a car? Will I be able to get to these? I think getting here with a car would be beneficial, but there are other ways to get to your clinicals if you need to. I will say, having moved from the Northeast and having lived in Philadelphia, the public transit system here isn't nearly as great as it was there, but there are still ways to get to TriStar if necessary. And this is the Office of Student Affairs and Diversity. This is the office that Jerome and I are in. This is where admissions is housed, but this is also where a lot of other things take place that don't necessarily involve, mostly don't involve things where you get graded. A lot of this is kind of support. A lot of this is things like student activities and wellness. We talk a lot about wellness. We talk a lot about it in the terms of that whole person approach. We talk about this in your physical wellness. We talk about this in your spiritual wellness, your financial wellness. All of these things. This is why you'll notice under student support services, we have things like providing first level financial advice, financial literacy counseling. And then also Dr. Riley, who heads up the student support services, she also will help you with your visiting student opportunities if you want to go do something away, or your ARIS application when you get ready to apply for residency. We also, Dr. Atkinson heads up our student activities and wellness programs. These are all the things that you think of like student organizations, student government. There's the Dean's Lecture Series. We're going to have something called the Med School Ball, wellness retreats, Dean's Olympics, all kinds of stuff. And then also we're going to have what are called Frist houses or society houses. We haven't really named them yet. You all will be the folks that will come to name those when you get here, but we're going to take the class. And I don't even think I've mentioned this. Our first class is 50 students. Our second class will be 50 students. Then we'll move up to 75, and then we'll move up to 100 students. But we'll take those larger cohorts and divide them up into these houses. And it's really cool. The most recent photos that we just posted on our Instagram account show the student lounge for the medical students, but they also show what the society rooms and the society houses rooms look like. And it's really cool. It's like you have your own little, basically kitchen living room there where you can study, talk, socialize, eat, hang out, and then move on and go to classes. And so you'll have an opportunity to have a place there that really is your own for studying and just making yourself feel at home at the medical school. Oh, I don't know why it duplicated that slide. All right, so let's talk a little bit about admissions. This is important for those of you that are thinking about applying to professional school in general, but really more specific to us. So AMCAS, we are, as I mentioned, we're on AMCAS. If you're not aware, AMCAS is the national application service for most every allopathic medical school or MD program in the country. So we are an MD granting institution. However, we are a private school, which means a couple of things: that we don't have a preference what state residency you're in or where you're from. In fact, we've already started to admit a handful of students. I think the first person ever admitted to the Frist College of Medicine was an Ohio resident. So again, no preference given to in-state versus out-of-state. However, you must be a U.S. citizen or permanent resident to qualify. Tuition should be around 50,000. We've started to get some preliminary numbers. It may be a little bit more than that, but the idea is that we want to be competitive with other private medical schools across the country. So we know that applying to medical school, we know that paying for medical school is expensive. And so what I can say is currently there aren't any plans for any massive debt relief or scholarships. I know a lot of times when medical schools open, they open with a big splash and they say things like, well, everybody's going to, first year class is going to have their class paid for. There have been no news of that yet. Again, that doesn't mean it won't happen. But I would say that if your sole reason for applying to the Frist College of Medicine is because of that, don't let that be your reason. But know that we do have a dedication to substantial debt relief. What that looks like yet, we don't know. So just keep that in mind. We also publish our minimum screening metrics. We want to make it very clear. Again, these are minimums. These are by no means what we would consider competitive, but these would be the minimum metrics that would get you recognized, get your foot in the door, give you an opportunity to get your application read. I know sometimes students, when I used to advise, they said, yeah, but is my application even going to be seen by an admissions committee member? If your metrics are above this, most likely they will be. And unless there is something else going on in your application, you're most likely going to get a supplemental application from us. So we also don't want to take your supplemental dollars if we don't plan on actually reviewing your application. So another question that I've been getting asked earlier is, what's our average MCAT and GPA? We don't know yet. We'll let y'all know. It'll be an MSAR as soon as we're able to publish that information. Preview, not required this cycle, but it probably will be required next cycle. And then also typical things that you would need: healthcare, letters of evaluation, and we typically recommend that they come from these three areas: one from a healthcare professional, one from a science faculty, and just one additional letter. If you're using like a committee letter or a committee packet, that will take care of all of the requirements for your letters of evaluation. Two important deadlines this cycle and this cycle only. It's because we do admittedly have kind of a weird cycle, and our timing is different than it will be in future years. In a typical application year, if you know about how that works, typically the application opens the first part of May, and then you finish up your spring grades, and then you submit your application the first part of June. We will be going to that cycle once we close this cycle out. So things are just a little bit offset. So if you know anybody that's applying to AMCAS schools, if you know anybody that has not applied yet and is above the 497 and 3.0, you might want to recommend that they apply. However, just another caveat that I will add to this is if you are waiting on a January MCAT, we will not accept January MCATs for this cycle. If you're going to get a January MCAT, just wait and apply next cycle for the Frist College of Medicine. If you are granted access to the supplemental, that is due by March 15th. So we've got a few more days left in our app cycle. And those are basic admissions. And then another thing we get asked, let me see how I'm doing on time because I want to leave plenty of opportunities for you guys to ask questions. But we want to attract students from across the country. As I mentioned before, we don't have a preference where you're from or what state you're from. But we want students that are both prepared in two ways, academically, so all those metrics and grades, yes, but also socially. We want you to understand what it's like interacting with people. It's a people profession. Medicine is such an important part. And then also, it's even better if you can have ever worked around sick people or those that have been in the clinic or hospital. We want those that are dedicated to service to others. One of the things that you haven't noticed that I've mentioned yet, or you may have noticed. If not, you're probably going to ask me about this. So I'm going to go ahead and head this one off. Is about research. So a common question is, do I need to have research? I know at schools like Hopkins and Duke, Baylor, that research was just such a big part of the undergraduate experience. And so, yes, research is awesome. Is it a requirement for admission into the Frist College of Medicine? No. But does it demonstrate that you know how to solve problems? Yes. Does it demonstrate that you bring curiosity and inquisitiveness? Yes. But can you demonstrate those in other ways that aren't just research? Also, yes. So research is great. It's something that we would love to see that you've explored. But if research isn't really your thing, that's okay too. So just know that you'll never see that as a very specific requirement here at the Frist College of Medicine. We also want to help build a diverse culture of inclusion. So if that's not your thing, you may want to look elsewhere. This is a very important component to us. And then also, this is directly from our dean of the medical school. He says he was like folks that are enchanted by the fierce work of medicine. And you may say, what does that mean? And because I know when we first heard it, we were kind of like, what does he mean by the fierce work of medicine? And really what it means to me is that this is the truth of medicine. This is the reality of medicine. This is knowing that medicine on a good day is awesome. When you save a life, when you diagnose a disease, when you are able to go give good news to a patient or a patient's family, that's awesome. But we also know that medicine isn't always that. You have to give bad news. You have to see some things that aren't necessarily always happy. Despite everyone's best efforts, sometimes it doesn't work out in the way that you had hoped as a physician, and that you now have to give that same news to a family or a patient. And that's not easy either. So we want to make sure that you understand that medicine has its hero days, and then it has its hard days. It has days that you smile in the mirror and you look at yourself and say, yes, I did it. But you also might shed some tears on other days when you're looking in the mirror too. So just remembering that fierce work of medicine encompasses a lot. And the more you can expose yourself to clinical experiences, the better equipped you're going to be for that. And then I'm going to add one more to this slide because our assistant dean for admissions, so she says also we want to look for students that are tolerant of ambiguity, meaning that they're okay with somebody saying, I don't know, or what do you think? Or we don't have that figured out yet, but we would love for you to come and help us bring that into focus. So a question that I got asked once was, are you going to have a student run clinic? And I said, I don't know. That's up to y'all. Y'all are the students. Y'all are the ones that are going to need to build that out, make that happen. Will we support you in doing that? Yes. Will we support you in anything that you want to do that makes sense? Yes. So that's another really cool part about being a new medical school is you'll never hear someone say, I don't know, we've always done it this way. Well, no, we haven't because we've never done it. And so I think that also that tolerance for ambiguity is important because we also want to make it very clear that if you're coming to our medical school, it's okay if you want to just sit and observe and sit in your hands and watch everything happen. But we would much prefer someone who is active and is collaborative and wants to help build the culture. We want you to be an active participant in that process. And so that's all the kind of things that I would say that we're looking for. And then lastly, as I mentioned, if you are currently an applicant and you have questions about your admissions or your application, just email medicine@belmont.edu. We'll make sure to get back to you about the status of your application if you have a question about that. As I mentioned before, go follow us on Instagram if you haven't already. See some really cool shots of the building. We're also doing the Faces of FCOM, which is your opportunity to kind of meet some of the people that are going to be working on the faculty and staff here at the Frist College of Medicine. And then the last thing, if you want to scan that QR code will get you on, give you the opportunity to sign up for one of our mailing lists. Mailing list doesn't sound too incredibly exciting, but it'll make sure that you get the newest information that we have. So, for example, if we do make an announcement about a scholarship, once we do start the building tours, I think we probably only sent out 3 emails to this once we opened it up, because we really don't want to bombard you with stuff. We really only want to update you when we have something important to let y'all know. So that is the main. Jerome, did I miss anything? Did I cover everything that I needed?
Yeah, I mean, yeah, I don't see. I'm going through my list of things, and yeah, it looks,
All right.
yeah, SimLab, most recent photo.
Yeah.
You highlighted the team, you know.
Yep.
Yeah,
I
I
think we
think
got
that's good.
everything.
Yeah.
All right, so Zuria, yeah, I think that's all we have as far as part of the formal presentation. So anything that I'll shut this down